Hello, welcome to Adapt and Class. Um, Today I've just decided to break down the SATA code again, and we're going to discuss how we can break it down so that you can see what it exactly it is. It's nothing but a lot of information that you already know. They put it in the question form. They give you multiple choices, and then you start worrying. Our brain is not used to picking more than one answer choice. That's not what it's made for. Innately, we don't like that when we have to select multiple choices within a question, but that is also what SATA is, select or that apply. So we're going to break it down again, how it's done. I just want you guys to be comfortable because when you go sit down for your exams, you see this SATA coming at you, just be comfortable and say, look, I can't handle this. I've seen this before. And then you can get it done goldenly. This is how you can break it down, okay, by doing the analysis. Your exams is all content, okay? Everything has a content, a certain level. They have a list. If you go to the nursing plan, there's a list of information they want you to know. But how do you know it and you can apply it? The best way is to have a study plan. So learning it is by learning the content is in such a way that you're looking forward risk factors for every problem. It doesn't have to be a disease. Like even restraint, there's a certain risk factor. You don't call it risk factor. Certain key facts you have to know about restraint. That's what they mean by key risk factors. And out of that, risk factors and the content, you can find signs and symptoms. Signs and symptoms, the things the patient will show, the pathological and the physical finding. The risk factors will lead you to the signs and symptoms. If you know how somebody is going to present with pneumonia, then it will be easy for you to treat them. And the signs and symptoms, what does it give you? It gives you prioritization. So if you know the signs and symptoms, and patient comes in and they say, who do you see first? You're looking for somebody who has the signs and symptoms that is going to die. And that is what we call be sharp. You are being sharp about it. You see how everything is interconnected? And then when you know the signs and symptoms, you can educate the patient to avoid those factors. Um, and then if they say something wrong, you can intervene and teach them. And this is your SATA. So they are all one, interconnected. So as you study, I don't know what you're reading right now, but start doing this to yourself. If you're learning a certain topic, ask about what disease process, what is the risk factor, what is the signs and symptoms, and which signs and symptoms should I worry about? Not all of the signs. You see, every staff things have more than one signs and symptoms. Like a drug may have like 1 to 5 signs and symptoms. All the five is not a priority. There's one in it that is in the B sharp, and that's the one you focus on in order to avoid morbidity. And that's all. And then when you have this information, the SATA gen want to play trick in your head. It basically want to let you pick more than one answer. And so pick it and let's go. You can do this. I mean, so don't let the SATA scare you at all. We can do this. We built for this. So I have a question for you. And so we're going to read the question. You know how I answer SATA question. Go for your ask, go for your case, go for your buzzwords, go for your rewrite. Okay, make a choice and move on. So your act is the last portion of the case. Okay. So and then your case is the rest of and the buzzwords is the keyword, and rewrite it in a way that you can take command. And then when you do that, that is where you bring in your content and you take those information and use it to answer the question. And when you answer the question, you make a choice from the top. You move until you make a choice. And when you make a choice, you don't come back for it again, except when you finish to check that this is what you want. Then you go. That's all. So what is the problem? Which assessment finding the nurse should include in evaluation concerning the medication? And so basically, this is not including the medication. So we are asking for assessment. Client was prescribed amitriptyline, so that's our buzzword for chronic back pain. So we have a patient who is on some form of medication. I don't know what it is for back pain. So buzzword is the same thing: medication and back pain. You see, they've given me in your exams. Whenever they give you a medication, they will tell you what it's used for. They're supposed to, because they don't want to give you the side effect and the symptoms. So they want to tell you this is what is used for. This is what is used for depression. So pay attention. Even if you don't recognize that medication that is being given to you, pay attention to what they subsequently say. They will tell you that this is used for that. Therefore, if you know what is used for, now you can deduce the answer choice from what is used for. You may not recognize the medication, but because you know what the medication is used for, and guess what? They've told you. So they partially has given you some information to answer the question, but not all of them. At least 50% of them, they have to tell you if they're going to ask you a SATA question. If they know, sometimes if you know a SATA question, they will give you an idea. So for this one, I've given you an idea. It's used for a back pain. It's a pain medication, right? But you look at it and say, well, this pain medication doesn't look like NSAID and Tylenol. Therefore, it's a special pain medication. There's some questions that it can be cleared. Now, so our rewrite. Somebody with back pain is on amitriptyline. What do? Then you ask yourself, amitriptyline is a TCA, and TCA is one of the most powerful medication with a lot of side effect. And so it has a lot of side effect. And the way for you to remember, I mean, this is the way I remember them, is I call it TCA dance. Okay. So the D is dermatitis. The the A is anticholinergic. So that's anticholinergic. The N is neurological. So they are neurological symptoms. The C is cardiac arrhythmia. So cardiac. And the E is basically evaluate all the above condition. Make sure you don't see it in the patient. And so that's when you rewrite, you come up with your content before even you look at the answer. And I'm taking this rewrite. I'm taking this rewrite and I'm taking it like a bag. And I go here. I said, are you in this bag? If you're in, I'm picking you. Valve frequency. Why would I have to know about valve frequency? Yeah, it's because of anticholinergic. Anticholinergic will make the valve frequency to go down, urine output to go down, pupillary dilation. So I need to know valve frequency. I need to know urine frequency. I need to know the quality of your vision. I'm breaking down SATA backbone. Confusion. Well, there's a neurological problem there, so I got to do that. Telemetry. Yes, cardiac. We got to check. He has cardiac arrhythmia. Skin evaluation. Yeah, dermatitis. You see what they do? They will set all these things. They get all the signs and symptoms and see if you can recognize some of them. And this is it. I use my TCA dance. I take it with me. So whatever your rewrite is, anything that you think is inside it, if they look, you compare it to the answer choice, and it has to be right. And that's how you break back the SATA backbone. You break his backbone really badly. So that's that. Let's try another one. A client was prescribed dicyclomine. Which of the following teaching the nurse should provide at discharge? So the same thing, our ask. Which of the following teaching should the nurse? So we have a teaching there. So the nurse has to do some teaching. And then you ask yourself, what is the case? Dicyclomine prescribed to the patient. So he has dicyclomine prescribed. Then what do? Buzzwords, the same thing. Dicyclomine and teaching. You see, 3 lines sentence, I'm only using 2 words. That's the rewrite. So I've taken ownership of the question. And then when you rewrite, you bring your content. The dicyclomine and then teaching. Then you ask yourself, what is dicyclomine? Well, it's an anticholinergic. And what does anticholinergic does? They can be constipation, pupillary dilation, dry mouth. Okay, all of them. Those are the symptoms of that. These 4, you have to know it. Every time there's a medication for anticholinergic, you have to know it. Dry mouth, what? Constipation, urinary retention, pupillary, and dilation. And the last one, they cannot sweat. If you can't sweat, you can be heat tolerance. Okay, so you should be heat tolerance. So let's look at it. Watch for urinary retention. Yeah, we talk about it. Sugar-free gum and candy. Why do you need sugar-free gum and candy? Yeah, because you cannot salivate, so it make you salivate. Avoid medication that causes pupillary constriction. Remember, I told you anticholinergics causes pupillary dilation. So we want to constrict them so that they can avoid the injury from the anticholinergic. So this is not appropriate. Drink a lot of water to avoid constipation. Yeah, good. Avoid excessive outdoor activities. What does that mean? If you go outside in the sun for a long time, you sweat. Okay? And sweating is the way of getting away heat. This one, they cannot do that. So the body can overheat and they can get it to heat stroke. So they should avoid that. You see what we've done? We break down the whole thing using the whole process of dicyclomine and telling you what it is and all that. And you're done. SATA is nothing. And finally, this is what we have. A client was diagnosed with diverticulosis. Which statement at discharge require immediate intervention? So, what do you think? The same thing, our acts. We need to intervene. Okay? What is our case? Patient has diverticulosis. Okay, buzzwords, losses, intervention, rewrite, content. So this is your colon. In the sigmoid, you have this packet you call diverticulosis. Is the packet outpouching pressure. This packet can get inflamed and become itis, diverticulitis. That's the inflammation. When this packet get inflamed, it become itis. But if not inflamed, it's losis. The losis that is already formed doesn't go away. It stays there forever. Okay, but you want to prevent more formation and you want to prevent them getting into itis. To prevent itis is to prevent pressure. We want to prevent pressure over there. This is the easy way for me to explain it to you. It's not actual pressure, but don't worry about it. This is take it like that. Oh, okay. We want to avoid too much pressure there. And therefore, we want to make our stool bulky. So that's how you need fiber. So fiber is for bulky stool. We want to make our stool bulky. That's why we eat fiber. 2, we need 2 to 3 liters of water a day. So 2 to 3 liters a day. And 3, we have to exercise 3 times a day, at least. And this is all you need. Therefore, 2 to 3 liters, good. Exercise twice a day, negative. So watch out for partial answers. Exercise, fine, but read the whole thing. It's twice. It's not adequate. Low residue diet, no. You need a high fiber diet. Docolas, no. We want to go regular. So we need just fluid and fiber to go, not take docolas. That means we are constipated. Avoid caffeine, good. Remember I told you caffeine is always bad in your test. This one, you say avoid it. When you're avoiding it, it's good. When you're taking it, it's wrong. So avoiding caffeine will help with hydration. So that means they have more water in their system, and that may help with the fiber. And that is how you break SATA code. Once again, know your acts, know your case, know your buzzword, rewrite to take ownership, make a choice, and move on, and never compare answer choice, and keep on going down. You make a choice and you go down, and that will make you more comfortable, make you more efficient in handling certain questions. If you're studying, make yourself questions. You can make yourself questions. You say, hey, I study pyloric stenosis. These are the things I think they will ask. And then treat and then ask yourself, how many of them can you answer without any problem? And then that means you're doing well if you're doing that. Take care of yourself and keep charging as always. It's a pleasure to be with you guys. All the best of luck. Bye.